Hello, dear Agoreans, how are you doing? I hope you are all safe. This is a video that I prepared to give you just the general outline or just a general knowledge about COVID-19 or coronavirus. First, the coronavirus or the COVID-19 is a respiratory virus that attacks our breathing system. So if we are infected with the virus, we will have different signs and symptoms which is associated with our respiratory system. The first and the most common one is dry cough, and the second one is we develop fever, and also we have muscle aches or it just hurts everywhere. And the another one is shortness of breath. If it is very severe, we might also need help, or we might need supply of oxygen at times if it is very severe. And sometimes patients might also present with vomiting and also diarrhea, and this is very rare, but it might happen. But the most important symptoms are dry cough. And the bad thing about this virus is, first, different individuals might not have these general symptoms that we know. They might be normal but still can infect each other. And the another bad thing about this virus is there is no vaccine, there is no treatment. So if you are infected with COVID-19, the only thing that you can have is just supportive treatment that you can get from any hospitals or any health centers. So what we need to do, right? If there's no vaccine or there is no treatment, what we can do is prevent it, because prevention is better than cure, always. So the first thing that we need to do is we have to wash our hands every 20 minutes, or if the place that we are in is not convenient to wash our hands, we can also use alcohol-based hand rub or hand sanitizer. That we can also use alcohol. And the second thing is wearing protective equipment. It could be glove, it could be a face mask. It's not that much effective, but it's better than nothing. So what I have seen in different parts of the city is that some of individuals wear protective gloves, but they just cannot keep their hands off their face. So that's another problem. So the another thing that you have to do is keep away your hands away from your face. That's really bad. I know it's difficult too, but you have to do it. You have to make it a habit not to touch your face, because the virus does not it's not in the environment, it's not in the air, it cannot stay in the air, but it can stay in our hands for about 10 minutes. And in that 10 minutes we just touch our faces so many times, so which is bad, right? So yeah, another thing is avoiding contact or social distancing. This is the best and the perfect way to avoid this virus. We have to stay home, or if it is important to go out, we have to be very careful. We don't have to go to very crowded places, and we have to try not to use a very crowded public transportations or taxi, and just do your best not to get infected. Because if you are infected, what you have to think is that if you are infected, you might survive, but think of your family, think of your friends, think of your boyfriends, your girlfriends, think of about your wife, your husband, your kids that you are going to infect, and they might even survive. Why would you be a reason for the days of your relatives, for the days of your loved ones? So whenever you are trying to go out, just think of that. And the another important thing is that if it is possible, if you are going out and when you are coming back, try to remove your shoes before just coming into the house, because most of the time the shoe might carry the virus and you might distribute it in the house. So that's really bad. I miss you all, guys. I miss all of the amazing sessions that we used to have, and I hope and I wish that everything get back to normal and we just start the regular meeting that we used to have. And please stay safe. If it is possible for you, stay home, and bye.